Coronary artery disease by Carlos Rodriguez. Anatomy, Professor Mohammed Khalifa. Coronary artery disease is a complex, multifactorial disease primarily caused by the buildup of plaque in the coronary arteries, leading to atherosclerosis. Several factors contribute to the development and progression of coronary artery disease, including genetics, environmental factors, and behavioral risks. Genetic predisposition plays a significant role in coronary artery disease susceptibility. Certain genetic variations can affect lipid metabolism, inflammation pathways, and endothelial function, increasing the risk of atherosclerosis. Familial history of coronary artery disease is a strong predictor of individual risk. Individuals with first-degree relatives who have had coronary artery disease at an early age are at higher risk. Specific gene mutations such as those affecting lipoprotein metabolism or inflammatory pathways contribute to coronary artery disease risk. Lack of physical activity contributes to obesity, hypertension, and dyslipidemia, all of which are major risk factors for coronary artery disease. Diets high in saturated fats, trans fats, cholesterol, and processed sugars increase the risk of atherosclerosis and coronary artery disease development. Environmental pollutants, such as particulate matter and nitrogen oxides, have been associated with endothelial dysfunction, inflammation, and acceleration of atherosclerosis. Tobacco smoke contains numerous harmful chemicals that damage the endothelium, promote inflammation, and accelerate plaque formation in the arteries. Heavy alcohol intake is associated with elevated blood pressure, dyslipidemia, and increased risk of arrhythmias, all of which contribute to coronary artery disease risk. Chronic stress can lead to the release of stress hormones like cortisol and adrenaline, which may contribute to endothelial dysfunction, inflammation, and hypertension, ultimately increasing coronary artery disease risk. Sleep disorders such as obstructive sleep apnea are associated with hypertension, dyslipidemia, and insulin resistance, all of which are risk factors for coronary artery disease. Machine learning algorithms have been developed to predict an individual's risk of developing coronary artery disease based on various demographic, clinical, and genetic factors. Some examples of AI models for coronary artery disease risk assessment include deep learning algorithms, analyzing electronic health records to identify high-risk patients, genetic risk prediction models that integrate genomic data with clinical variables to estimate an individual's genetic predisposition to coronary artery disease, risk calculators based on machine learning techniques such as support vector machines or random forests that incorporate multiple risk factors to predict the likelihood of coronary artery disease development over time. Coronary artery disease is more prevalent in older individuals, with the risk increasing with age. Historically, men have been more commonly affected by coronary artery disease. However, postmenopausal women have a significant risk, and coronary artery disease is a leading cause of death in women as well. Certain racial and ethnic groups have higher incidence rates of coronary artery disease. For example, African Americans, Hispanics, and Native Americans have been shown to have a higher rate of coronary artery disease compared to Caucasians. In the United States, coronary artery disease remains a leading cause of death in the United States, contributing to approximately 1 in every 4 deaths. According to the Centers for Disease Control and Prevention, an estimated 18.2 million adults in the United States have coronary artery disease. Internationally, coronary artery disease prevalence varies across countries influenced by factors such as lifestyle, healthcare access, and genetic predisposition. For example, in developed countries with high-calorie diets and sedentary lifestyles, coronary artery disease prevalence tends to be higher compared to developing countries with different dietary and lifestyle patterns. Coronary artery disease primarily affects the coronary arteries, which supply oxygen-rich blood to the heart muscles. These arteries can become narrowed or blocked due to the buildup of plaque, leading to reduced blood flow to the heart. When coronary arteries are narrowed or blocked, the heart muscle may not receive an adequate supply of oxygen and nutrients, leading to ischemia, which is a reduced blood flow. Prolonged ischemia can result in myocardial infarction, also known as a heart attack, which occurs when a portion of the heart muscle dies due to the lack of oxygen. The hallmark of coronary artery disease is the development of atherosclerosis, characterized by the accumulation of plaque within the walls of the coronary arteries. Plaque consists of cholesterol, fatty deposits, inflammatory cells, and cellular debris. Over time, plaque can become hardened and narrow the arterial lumen, reducing blood flow to the heart muscle. Endothelial cells lining the coronary arteries play a crucial role in maintaining vascular health. In coronary artery disease, endothelial dysfunction occurs due to factors such as inflammation, oxidative stress, and abnormal lipid metabolism. Dysfunction of endothelial cells lead to impaired vasodilation, increased vascular permeability, and enhanced adhesion of inflammatory cells, promoting the formation and progression of atherosclerotic plaques. Chest pain or discomfort is the most common symptoms of coronary artery disease. Angina typically occurs during physical exertion or emotional stress and is caused by reduced blood flow to the heart muscle due to coronary artery narrowing. Reduced blood flow to the heart can impair cardiac function, leading to symptoms of heart failure such as shortness of breath, especially during exertion or when lying flat. Inadequate oxygen supply to the heart muscle can result in fatigue and weakness, particularly during physical activity. Some individuals with coronary artery disease may experience palpitations or irregular heartbeats due to the disruptions in the heart's electrical conduction system. If a coronary artery becomes completely blocked by a blood clot formed on a ruptured plaque, it can lead to myocardial infarction, causing irreversible damage to the heart muscle. Chronic ischemia and myocardial damage due to coronary artery disease can impair cardiac function over time, leading to heart failure, a condition characterized by the heart's inability to pump blood effectively to meet the body's demands. Coronary artery disease can disrupt the normal electrical conduction system of the heart, increasing the risk of arrhythmias such as atrial fibrillation, ventricular tachycardia, or ventricular fibrillation, which can be life-threatening if not treated promptly. The survival rate for coronary artery disease depends on various factors, including the extent and severity of coronary artery narrowing, the presence of comorbidities, and promptness and effectiveness of treatment interventions. According to the American Heart Association, the 5-year survival rate after a myocardial infarction has improved over the years, with advancements in medical and interventional therapies. Coronary artery disease remains a leading cause of death globally. In the United States, it contributes to approximately 1 in every 4 deaths. A healthcare provider will assess the patient's medical history, risk factors, and symptoms, and perform a physical examination to evaluate cardiovascular health. Some diagnostic tests include EKGs, which record the heart's electrical activity to detect abnormal rhythms and signals of ischemia. Stress testing evaluates heart function during physical exertion to detect exercise-induced ischemia. Coronary angiography is an invasive procedure using contrast dye and x-rays to visualize the coronary arteries and identify blockages. Cardiac imaging is techniques such as echocardiography, cardiac CT, and cardiac MRI, which may be used to assess cardiac structure and function, detect myocardial ischemia, and evaluate the extent of coronary artery disease. Medications used to treat coronary artery disease include antiplatelet agents, which consist of aspirin, clopidogrel, and other antiplatelet drugs to reduce the risk of blood clot formation. Statins, which lower cholesterol levels to prevent plaque buildup and reduce the risk of cardiovascular events. Beta blockers reduce heart rate and blood pressure, relieving symptoms and protecting the heart. ACE inhibitors improve heart function and reduce blood pressure, particularly in patients with heart failure. Nitroglycerin relieves chest pain by dilating coronary arteries and improving blood flow to the heart. Common surgery and invasive procedures include percutaneous coronary intervention, also known as angioplasty, which involves balloon dilation and stent placement to open narrowed or blocked coronary arteries. Another is coronary artery bypass grafting, which is a surgical procedure to bypass blocked coronary arteries using grafts from other blood vessels. Some behavioral modifications that can be adopted are a healthy diet, low in saturated fats, cholesterol, and sodium, and rich in fruits, vegetables, whole grains, and lean proteins. Regular exercise, such as aerobic exercise, brisk walking or swimming, improves cardiovascular fitness and reduces coronary artery disease risk. Quitting smoking is essential to reduce coronary artery disease risk and improve overall health. Techniques such as mindfulness, meditation, and relaxation exercises can help reduce stress levels and improve cardiovascular health. Side effects vary depending on the type of medication, but may include gastrointestinal upset, muscle aches, liver or kidney dysfunction, and allergic reactions. For invasive procedures, risks include bleeding, infection, allergic reactions to contrast dye, blood vessel damage, and complications related to anesthesia. Behavioral modifications include adoption of healthy lifestyle changes, which may require significant effort and commitment, and adherence may be challenging for some individuals. Coronary artery disease is typically a chronic condition that requires ongoing management to control symptoms, prevent complications, and reduce cardiovascular risk. While treatment can alleviate symptoms, slow disease progression, and reduce the risk of cardiovascular events, coronary artery disease is not usually curable and may require lifelong management. AI models for diagnosis and treatment include machine learning algorithms, which analyze medical imaging data, for example CT scans and MRIs, and detect and characterize coronary artery lesions, assess plaque composition, and predict patient outcomes. Genomic risk prediction models. These integrate genetic data with clinical variables to identify individuals at increased risk of coronary artery disease and tailor treatment strategies accordingly. Clinical decision support systems. These assist healthcare providers in diagnosing coronary artery disease, selecting appropriate treatments, and monitoring patient progress based on evidence-based guidelines and patient-specific data.